Hey, everybody, welcome to Sex is Medicine. I am your host, Devi Ward Erickson, here with you for another amazing and enriching and delicious Thursday evening where we have intimate conversations exploring the intersection of sexuality, spirituality, pleasure, and personal growth. I am here this evening with you with another Sex is Medicine alumni, Dr. Ronald Goldman, PhD. Dr. Goldman was on our show many, many years ago, I believe in 2014 or 2015, sharing with us the wisdom of circumcision and the trauma that it inflicts upon our young men. Dr. Ronald Goldman, PhD, is a psychological researcher, speaker, and writer, and he is the director of the Early Trauma Prevention Center. His work includes hundreds of contacts with parents, children, and medical and mental health professionals. He educates the public and professionals about generally unrecognized origins and prevention, of emotional and behavioral problems that have often overlooked beginnings during infancy. This information can improve personal and social experiences. Dr. Goldman's publications have been endorsed by dozens of professionals in mental health, medicine, and social science. His writing has appeared in newspapers, parenting and medical publications, and textbooks, and he has participated in over 200 media interviews. You can find more information at ronaldgoldmanphd.com, and we will absolutely drop that link in the description below this video. And it is such an honor to have you here with us this evening, Dr. Goldman. Thank you for joining us.
Pleasure to be with you.
Yay, awesome. So I am so excited to have this conversation because trauma and the impact that has on the brain development and our physiology, it shows up a lot in the work that we do. So I'm so excited to dig into this more deeply. So in your research, what is the root cause of American personal and social problems?
Well, first, I'd like to give you an overview.
Yes.
A day of prevention is worth years of treatment. Mm-hmm. The public is generally not aware of the origins and potential prevention of American personal and social problems. Such problems are often connected to long-term emotional and behavioral difficulties. Consequently, we're not doing well at trying to deal with the problems such as violence, racism, politics, and mental health. This is why I started the Early Trauma Prevention Center. I want to expand the awareness of how early traumas are connected to our problems. We need to examine our childcare beliefs and practices. Because it affects society, caring for children is our common concern. Early trauma, in this context, is an overwhelming psychological experience, often involving extreme pain, sadness, fear, or anger. There are traumas of commission and omission. An example of commission is physical harm. An example of omission is lack of physical contact. The emotions become unconscious for our psychological survival, but the body remembers what the mind forgets. There can be ongoing symptoms such as anxiety, avoidance of situations, depression, irritability, and effects on behavior.
Wow. So how early are the signs of such problems able to be identified?
Research shows that an angry temperament in infancy is associated with aggression at age 7. Wow. Other research shows that aggressive behavior with peers is stable for the first 10 years of life. In a long-term study, boys who were more aggressive at age 8 were more aggressive at age 30. Based on the research, emotional and behavioral difficulties can start as early as infancy.
Wow. Wow. So what contributes to these early signs and symptoms?
This research is relevant. In the 1950s, Harry and Margaret Harlow conducted classic monkey studies. Monkeys raised in cages at their testing location without physical contact with mothers became depressed and aggressive toward normally behaving monkeys. When these monkeys became mothers, they did not respond to or touch their offspring. Brain development studies showed that lack of physical contact changes brain areas that control affection. Nature and nurture cannot be separated. Experience changes biology. In cross-cultural studies, a researcher predicted the peaceful or violent tendencies for 39 of 49 cultures from one mother-infant bonding practice. Baby carrying on the mother's body or a close relative acting as mother all day for the first year of life. When there is little physical affection, antisocial behavior is high. When there is much physical affection, antisocial behavior is low. Decades of studies show that the quality of the mother-infant bond affects social development, empathy, and more. Researcher John Bowlby examined children with emotional and behavioral problems and was able to connect their problems to histories of disrupted mother-infant bonds that involve maternal deprivation.
So what can disrupt that mother-infant bond? Because that sounds like that is critical.
Various factors can disrupt the mother-infant bond. The relationship starts during pregnancy. The fetus and mother communicate physiologically and emotionally. The bond can be disrupted by the mother not wanting the birth. In this country, about 3 in 8 births are unwanted. The bond can also be disrupted by the infant being separated from the mother, unmet biological and psychological needs, maltreatment, and trauma. These factors will be mentioned repeatedly. We are designed for pleasure, not pain. The behavioral and physiological responses of human infants to separation from their mothers are similar to the responses of monkey infants. Also, as observed in animals, early events affecting the mother-infant relationship can have long-term consequences on maternal behavior and infant development. For example, diminished mother-infant contact after birth has been associated with differences in maternal behavior toward the infant after 1 year and later differences in how the mother communicates with her child. Numerous studies show that disrupted bonding, also called attachment disorder, is a major contributor to mental health problems, including distress, personality disorder, low self-esteem, depression, anxiety, and excessive weight from eating disorders. Research also shows that about half of Americans reported at some point in their life having at least one mental health problem. It is no coincidence that American attachment disorder is epidemic at about 50%. The quality of attachment is a biological and emotional foundation for the quality of future mental health and relationships. The long-term effects of disrupted mother-infant bonding have not received the widespread attention they deserve. A secure bond is a primary need.
So it sounds like you're really targeting American cultural practices as opposed to like worldwide. So what are the specific American cultural practices that disrupt this mother-infant bond?
Here are 6 primary practices. First, a clarification. For example, if common cultural practice A is associated with behavior B, and the percent increase in behavior B is from 5% to 20%, this is significant, though most people do not have behavior B. Therefore, when I mention a cultural practice, and you or your child does not have behavior B, this does not refute the result that behavior B is more likely to occur. If you are a parent, upon hearing some of this information, you may be tempted to blame yourself for what you did or did not do in raising your children. Please don't. In this society, as in others, parents do the best they can based on what they know, what the culture supports, their personal circumstances, and other factors. Similarly, professionals who work in related fields are subject to personal, professional, and cultural constraints on their activities. Let's have compassion for ourselves and others. Many people have experienced at least one of these practices. So first, there's hospital birth. A typical American birth is transformed from a natural event to a medical event. The mother gives up control of the birth to a doctor. Routine experiences for the baby can include the pain, distress, and possible physical injury from amplified contractions connected with induced labor, the use of forceps extraction following the use of epidural anesthesia, premature clamping and cutting of the umbilical cord, an injection of vitamin K, burning and blurring eye medication, heel lancing for blood samples, injection of hepatitis vaccine, and being straightened out for measurements. The effects of all these routine experiences on the infant are ignored. The separation of newborn babies from their mothers after birth, still standard policy in many American hospitals, can result in psychological trauma and long-term neurobiological changes. Newborn infants have an urgent need to be held by their mothers. The separation is more prolonged for those infants in neonatal intensive care units. Being placed in these units involves considerable invasive pain for infants. Designers of these units did not consider that infants could feel and remember pain. If they survive, many infants are left with long-term emotional distress. No study shows that birth in a hospital is safer than birth outside of a hospital with competent support. With number one being the lowest rate, the United States ranks 56th in infant mortality and 47th in maternal mortality, among other countries. More technology and drugs do not necessarily make birth safer. They make it more likely that there will be unnecessary interventions with the natural birth process, resulting in complications. A number of studies suggest a relationship between birth complications and violent behavior. In a study that received national attention, investigators followed over 4,000 male infants to age 18. They found that those infants who had experienced both birth complications and disrupted bonding were most likely to engage in violence when they grew up. In another study, 15 of the 16 most violent criminals were found to have had an extraordinarily difficult birth, and the 16th had an epileptic mother. Another research report found that certain types of birth complications were associated with a preferred method of suicide, which is violence to the self. For example, suicides involving asphyxiation were closely associated with breathing difficulties at birth. Suicides by violent mechanical means were associated with mechanical birth trauma, for example, forceps delivery. And drug-related suicides were associated with drugs having been administered to mothers during labor. Furthermore, the American cesarean birth rate was 4.5% in 1965. It is now about 1 out of 3 hospital births, and the highest in the Western world. In addition to being a major intervention in the natural birth process, cesareans involve more separation between mother and infant at birth increased chances of the infant being assigned to a neonatal intensive care unit, and the increased risk of disrupted bonding. Painful experiences, unmet needs, trauma, drugs, shock, and separation of the mother and infant make a difference. These cultural birth practices generally ignore the child's needs, what is natural, and what supports bonding. In 1975, obstetrician Frederick Laboyer published a book called Birth Without Violence. In the United States, birth is often still violent, and so are we.
So there is a direct link between how we come into this world and where we end up. And this epidemic of violence is something that me and my colleagues have been speaking about. Like, I mean, just like, it's crazy. It's like people are just going crazy. So it makes sense, it's this accumulation of trauma, and then it's passed down and perpetuated through each generation.
Mm-hmm. Yeah, I'm going to get to that a little bit more later.
Okay.
So here's another cultural practice.
Mm-hmm.
And for this, I asked viewers and listeners to please close your eyes for a visualization related to this additional cultural practice. So with your eyes closed, imagine that you are resting comfortably, perhaps with a dearly loved person you enjoy being physically close to. When a few strange people enter the room and proceed to pick you up and carry you away. You protest and struggle, but they are stronger than you are. They take you to another room where they remove your clothes, strap you down on your back on a table. The only part of your body that you can move is your head. All this time, they continue to disregard your protest. Then a man enters, and after seeing that you are securely restrained, he uses a clamp, knife, and other instruments to cut off a piece of highly sensitive specialized tissue from your genitals. The procedure lasts about 15 minutes. You scream repeatedly, but your screams are ignored. Notice how you feel. Then open your eyes and remind yourself that you are safe. This visualization was similar to what happens to a male infant when he is circumcised. From the experience of the infant, it is an act of violence. Circumcision causes extreme pain and trauma, potential withdrawal and shock, behavioral and neurological changes, loss of an important functioning body part, reduced sexual pleasure, potential psychological problems, more than 100 possible complications and risks, and many unknown negative effects. There are no proven actual medical benefits of circumcision, and no national medical organization in the world recommends circumcision. Aside from Americans, Muslims, and Jews, only about 5% of the world's males are circumcised. Some doctors and nurses refuse to participate in this practice, and some Jews don't do it. The more men know about circumcision, the more likely they are to regret it and oppose it. Some men are angry about being circumcised. Other men are angry and do not know it, or do not connect their anger with circumcision. Child psychiatrist Lenore Terr said, quote, "A whole life can be shaped by an old trauma, remembered or not," unquote. The extreme pain and trauma of circumcision violate the child's need for protection from harm, involve separation from the mother, maltreatment, and disrupt the mother-infant bond. Maternal-infant interaction and infant behavior are adversely affected after circumcision. Long-term effects may increase the likelihood of emotional and behavioral problems, including antisocial behavior. As a final note on this topic, I initiated a legal challenge to Medicaid circumcisions. I invite you to go to GoFundMe.com, search my name in quotes, and you'll be able to find a description and status of that legal case.
So you were bringing a legal case against Medicaid for like to not allow our basically it's our tax dollars, right, is what pays for Medicaid. So
Yep.
to no longer have our tax dollars to pay for infant male circumcision.
That's right. Yep.
Okay, wonderful. So we will contribute to that. Yeah. And so a couple questions in terms of circumcision. So my understanding is that it's infant male circumcision that is so horrendously detrimental. I know that in some cultures, like I believe there's an African culture that it's a rite of passage for, the adolescent boy to be circumcised as a signpost of becoming a man. So the changes in the brain, are those, in your research, are those less severe if the circumcision happens later versus being an infant?
Well, it's different. I don't know of any comparisons in severity, but it's clear that if this is forced on a person at whatever age, if it's forced on a person, there's going to be significant trauma, and there's going to be long-term effects, behavioral effects, emotional effects, psychological, and there's possible connections here with violent behavior associated with having forced circumcision done. If you're 2 years old, 10 years old, 16 years old. Mm-hmm. I've looked at research on the internet, and there are charts that show that the areas of the world where circumcision is forced on people are also likely to be areas of the world where there's violence going on.
Yeah.
And these are primarily, but not all, Muslim cultures that they tend to postpone circumcision to. It's not postponement to them. This is their cultural norm, is to have it done at whatever age they have in their tradition. Mm-hmm. So when it's done at whatever that age is, the boy knows it's coming, and he knows that he doesn't have a choice. Mm-hmm. So however he feels about it or fears it, he's going to be overwhelmed, and they're going to do it to him, so it's going to affect his psychological behavior. How could it not? I mean, imagine yourself in the same situation. Exactly.
It's a trauma. Yes. And so that's just number two of the common American practices. Okay, keep going then.
Okay, another cultural practice, bottle feeding, is about 100 years old and limits or denies the well-documented benefits of breastfeeding. The importance of breastfeeding to the emotional and physical health of the infant is often unappreciated. The advantages of breastfeeding over bottle feeding include improved bonding, short and long-term health benefits, and improved intellectual and neurological development measured at age 10. The World Health Organization and UNICEF recommend breastfeeding for 2 years of age or beyond. In America, many mothers stop breastfeeding after 2 weeks. At 6 months, only 25% of mothers are exclusively breastfeeding. The proportion of infants born at American hospitals with policies that support breastfeeding is 28%. Our culture has changed, but the biological and psychological needs of infants have not changed. As stated earlier, unmet needs are associated with disrupted bonding, which can contribute to emotional and behavioral problems and a greater likelihood of antisocial behavior. Well,
Yeah. And what comes to mind for me with the breastfeeding is like, our culture, the systems of our culture do not support that mother infant bonding because, how many single mothers need to like just put the infant in daycare and get back to work to put food on the table, or how many two-parent households the woman has a career and she can't take 6 months off of work because she'll get fired or replaced at her job. So the systems of the United States and North America specifically literally are designed to prevent and interfere and make it almost impossible to adhere to these nature-based, these biological needs.
yep.
Yeah.
Okay. All
Is
right.
that what you're pointing to, Dr. Ram? That the systems, the culture of the United States and the systems that are in place are kind of designed to perpetuate this violence?
Well, they are, and
Yes.
I've got a lot more to say about it.
All right. Well, let's let you have the mic back then.
Okay, another cultural practice, isolated sleeping for infants, is a cultural practice here, and it's about 200 years old. Throughout history and in non-Western cultures, infants have slept next to their mothers. Worldwide today, the overwhelming majority of infants sleep next to their mothers. According to the research, mothers who co-sleep with infants breastfeed an average of twice as long as non-co-sleeping mothers and exhibit 5 times the number of protective behaviors such as adjusting the infant's blanket, stroking, or cuddling. Boys who co-slept with their parents between birth and 5 years of age had significantly higher self-esteem and experienced less guilt and anxiety. For women, co-sleeping during childhood was associated with less discomfort about physical contact and affection as adults. Co-sleeping appears to promote confidence, self-esteem, and intimacy, possibly because it instills in the child a feeling of parental acceptance. Many parents who co-sleep feel that they become more attuned to their baby. They feel that their sensitivity to the needs and patterns of their baby at night translates into daytime sensitivity as well. Co-sleeping parents tend to believe that this practice powerfully contributes to the overwhelming relationship with the child. Isolated sleeping involves unmet needs, separation, and weakens the mother-infant bond. This could be associated with an increased likelihood of emotional and behavior problems and antisocial behavior.
Yep, and low self-esteem. Wow.
Yeah,
And that makes sense because I remember reading years ago that like when we sleep with other people, our brains are in training to one another. So that would make sense that sleeping with your infant, and all together as parents, your brains are in training to one another. So then in your daily activity, you're already attuned, you're already in training.
yeah,
Yeah.
very good.
Yeah.
Okay, another one. Although it is widely accepted in the professional literature that optimum care for an infant requires almost constant contact with the mother or a substitute mother, this level of care is not typical in America. About 55% of all infants have mothers who work outside the home, as you referred to earlier. By contrast, for at least 90% of human history, the infant was in contact with the mother 70 to 80% of the time during the first year, and the rest of the time with someone else acting as a mother. Extensive non-maternal care of infants is associated with insecure mother-infant attachment and other adverse outcomes.
Yeah.
The National Institute of Child Health and Human Development study of early child care was the largest long-term study of child care ever conducted. It found that the more time children spend in any of a variety of non-maternal care arrangements across the first 4.5 years of life, the more problems they have with, you ready? Fighting, cruelty, bullying, and meanness at the age of 4.5 years and in kindergarten, as reported by mothers, caregivers, and teachers. Non-maternal child care involves separation, unmet needs, disrupted bond with mother, and increases the likelihood of emotional and behavioral problems and antisocial behavior.
Wow. Yeah. And again, like we were saying earlier, the way the system is designed, it's almost like it's intentionally designed to perpetuate violence.
Well, we designed it, and we'll talk about that later. Collectively, we designed it. Okay, moving on here. Corporal punishment is the intentional infliction of physical pain for the purpose of punishment. Examples of corporal punishment include slapping, spanking, and hitting with objects. Corporal punishment is incompatible with the United Nations Convention on the Rights of the Child and the recommendations of the American Academy of Pediatrics and the American Psychological Association. 62 countries have adopted national policies against corporal punishment in all settings as an effective public education measure. However, in the United States, corporal punishment is common, but is decreasing. Corporal punishment involves maltreatment, potential trauma, unmet needs for safety and compassion, and disrupted bonding. An analysis of 88 studies found strong associations between corporal punishment and 10 negative outcomes, including eroded trust between parent and child, more child aggression towards siblings, bullying, withdrawal, and antisocial behavior. Other findings in the literature include that corporal punishment increases the risk of depression, low self-esteem, reduced empathy, child abuse, later retaliation with assault of the parent, and later violence with family and friends. So that's quite a lot.
Yep. And I remember being a little kid and getting my booty whooped by my dad. And
I'm sorry to hear that.
Yeah, it's prevalent in certain cultures in the United States for sure. That my dad used to say he's going to take a belt or take a switch and beat me into whenever I was submission or agreement or whatever. And I remember being infuriated and feeling as if my humanity was being robbed. I mean, and I was little, and I remember that, like, just furious, like, how dare you?
Yeah. Well, it has been very common throughout our history, and fortunately, the rates are reducing, but we still got a long way to go.
Yes, we do.
And I'll just give you a quick anecdote here regarding retaliation against parents.
Yeah.
I had an older brother, and he had behavioral problems when he was young, and my parents didn't know what to do, and at some point, my father directed some corporal punishment at him. And when he was a teenager, he retaliated and beat up my father.
Wow.
So that's the risk you could be taking if you do that to a young child.
Wow. Yeah, comes full circle. Thank you for sharing.
Okay.
Yeah.
Okay, so what's next? Devi, you got one?
So we are our cultural practices. And so how do our cultural practices impact our other social problems? Because that's an outline of many different, very normal practices in this culture, and they impact our development as mature human beings. And then it's mature human beings who are making up our society and making up our culture. So how does all of this, translate to our other social problems that we're struggling with?
Okay, so here's a study that helps to answer that question.
Mm-hmm.
In research comparing Finnish and American infants, this is very interesting. The Finnish infants scored significantly higher than American infants on measures of smiling and laughter. American infants scored significantly higher on fear, which is connected to adverse early experience. When one is fearful, one wants power and control rather than cooperation and collaboration.
Yeah.
It is also understood that when one has low empathy, a lack of ability to be sensitive to what others feel, one is more likely to care about self-interest and common interest. Wanting power and control and caring about self-interest can influence political views and behaviors. In addition, low empathy, an effect of disrupted bonding, is also associated with racism. Since the quality of the mother-infant bond affects self-esteem, research shows that those with low self-esteem are more likely to be prejudiced against others. So there we have there's direct connections here between our cultural practices and some serious problems, as I say, political behavior and racism.
Yeah. And what's coming to mind for me is how trauma perpetuates trauma. So like, for those of us who are people of color, the trauma of racism impairs our development, and impairs the health and well-being of our parents, and impairs our health and well-being. And then for the people who perpetuate racism, all of that is rooted in a lack of love, in that disrupted infant bond. And then it's just passed down and perpetuated throughout society. It's horrific. And it all starts at the same thing, which is the love. What I'm hearing from you is the natural human love and biological need for connection and affection from in utero onwards.
Sure. Yeah. I want to say a little more on the how we're perpetuating this disrupted bonding.
Yeah, please do.
Researcher Mary Main found that attachment quality of adults corresponds to the attachment quality of their children 76% of the time. Another study found a correspondence of 85%. Parents often had disrupted bonding when they were young. The repeating cycle includes alienation caused by disrupted bonding, conformity, which provides the illusion of relief from alienation, acceptance and use of existing cultural practices, and disrupted bonding of the next generation. So that's the cycle as it goes around generation after generation.
And so that makes sense. So when my ability to bond with my parent is disrupted, then I don't form the understanding or the ability to then form healthy attachments later on in life, if those aren't repaired, right? And because we live in a very trauma uninformed culture, most people are walking around with trauma that they're not aware of, right? So I'm not able to then bond with my child and then them bond with their child. So it's again, unless we can heal and repair that. Yeah.
Okay. Go ahead.
And so what about our cultural beliefs and values? How does that contribute? Because it just seems like the way we are as a culture perpetuates this issue.
So I have a few examples about this, and it's important. American childcare practices are based on supposed rational factors. Yeah. Because Americans, particularly men, tend to value the intellect over the emotions. This preference is consistent with our general difficulty in being aware of and expressing feelings. One of the consequences of this condition is when we don't feel, our thinking is affected. Suppressed feelings limit our experience and can lead to false beliefs. An observer of medical professionals wrote, quote, "They mistake having no feelings for being smart," about medical professionals now. If we could feel, our empathy for infants would support changing our cultural practices. Some parents also believe that denying satisfaction of children's needs teaches them independence, makes children less needy, or avoids spoiling them. There's no evidence to support these beliefs. As previously stated, when we do not feel, our thinking is affected. To be clear, needs are distinguished from wants. Needs are universal. And when needs are consistently not satisfied, the result can be developmental problems. Another belief is implied from some adult attitudes and behavior. Children are the property of their parents. This belief may involve maltreatment and deny children respect, ignore their humanity and autonomy, and diminish their need satisfaction and bonding. So we got, some beliefs out there that just don't help at all and actually hinder care for children.
And expanding upon that intellectual bypassing, it's my understanding that that's actually a coping mechanism for a certain type of developmental trauma. So when that mother-infant bond is interrupted in early childhood, then there's a trauma in our ability to connect. And so because of the pain of that, because connection is core to us as humans, because of the pain of that, some people disassociate and live in the intellect or live in the spiritual realm. So that prioritizing the intellect is actually symptomatic of connection-based trauma. Yeah.
Okay. And again, being in the intellect or using the intellect contributes to the problems here.
So it's this cycle that continues to and there are cultural values that support and prioritize intellectual bypassing as opposed to the feeling which is in the body.
Yeah.
So how do we change this? What are your thoughts? This is your life's work.
Let me just mention another attitude toward infants.
Okay.
Is that they're sometimes called it. This is not done with older children and adults when the sex is not known, only with infants. Also, many assume that what is done to infants is not important and has no long-term effects because they're not sufficiently developed to retain the effects of their early experience. The typical attitude toward infants was perhaps illustrated by an incident a father related to me concerning his 2.5-year-old son. He asked his son to put the milk in the refrigerator. After his son did this, the father, for the first time, thought, he's a real person. My son is a real person. Evidently, it was both his son's understanding of language and his ability to perform a customary physical task that led the father to this realization. But what about the first 2.5 years of his son's life? Apparently, the father had not previously considered his son to be a real person. Infants are real people. They feel deeply and are aware, sensitive, perceptive, and responsive.
Yeah.
All senses are working. They have purposeful movement. Cries are meaningful and can express needs. The behavior of infants is rational, and they are enthusiastic learners. Newborn infants have specific preferences, and they can even evaluate their experience. For example, a professional was contacted by a couple whose infant took hours to nurse. He then learned from the couple that the only time they held the infant was during feeding. His conclusion was that the infant learned this connection and used it to be held. When the parents were made aware of this, they changed their behavior toward the infant, and the infant no longer extended feeding time in order to be held. How about that?
Wow. I mean, we're brilliant. We're brilliant beings, of course. Wow. Yeah. Wow. That's beautiful.
Here's another cultural value that contributes to our problem. We sometimes have a misplaced focus on the physical.
Yes.
In 1995, premature infants were born in a Massachusetts hospital. They were placed in separate incubators conforming to standard practice in the neonatal intensive care unit. One baby had breathing and heart problems and was not expected to live. A nurse was unsuccessful with attempts to help her. Then she had an idea and placed the critical baby in the incubator with her twin sister, though it violated hospital rules. Immediately, they snuggled together, and the healthier baby placed an arm over her sister in an endearing embrace.
Oh my God.
The weaker baby's heart rate stabilized, and her temperature rose to normal. Providing the weak infant with only technology focused on physical support was not enough. She needed human touch and emotional connection.
Yeah.
A photograph of the twins became famous and was called the rescuing hug.
Wow.
As an example, research on emotional, as another example, research on emotional and behavioral problems is typically focused on biological deficiencies.
Yep.
As I have said, experience changes biology.
Yep.
Mistaken beliefs have misdirected research away from prevention and toward financial rewards. Drug companies seek to provide quick fixes and receive billions of dollars in profits. In addition, maternity care is the largest source of income for hospitals, and cribs and strollers are good for business, but not for young children who need body contact.
Wow.
So we got a lot of work ahead of us.
We do. So what are we going to do, Dr. Goldman? What can we do?
So my recommendations to improve the welfare of children and prevent personal and social problems include natural birth, no circumcision, breastfeeding when the infant chooses, extended maternal body contact for improved bonding by using a baby sling, wrap, or carrier, co-sleeping, prudent later use of non-maternal childcare, and no corporal punishment. Awareness of information associated with these recommendations can help parents make more informed choices in raising their children.
Mm-hmm.
Let's support childcare choices that are consistent with our instincts. Ask 3 valuable questions. Is it natural?
Mm.
If we trust and respect nature, we will not lose our own nature.
Mm-hmm.
Does it satisfy the child's needs? This is required for healthy development.
Yeah.
Third question, does it support the child's bond with the mother? When the bond with the mother is disrupted, the bond with humanity is disrupted. Help from the father, relatives, and friends is important, but the mother is primary.
Wow. I just saw something in like neon light. When the bond with the mother is disrupted, the bond with humanity is disrupted.
Yeah.
Wow. Like, wow. Mic drop. That wow. And so what's coming to mind, in terms of like how to make these changes is, yes, education on an individual level, but we need these systems to change, because I, as a single mom, may want to carry my baby to work all day with me, but my manager is not going to let me.
Okay. So the way these changes can be supported, we need economic, political, and social support for families. It's pretty clear.
Yep.
We have the worst maternal leave policies of any developed country. Our national policy is 12 weeks of unpaid leave. European countries have 1 to 3 years of paid leave. Also, let's have more and improved parenting and child development education. In addition, widespread education of teenagers about birth control would help. About 40% of pregnancies are unwanted. Also, let's reconsider our cultural priorities and make the welfare of families a higher priority. Yeah. In return, we would save billions of dollars and have a higher quality of life. And we need more assertiveness by women regarding infant and child care.
Yeah. Well, I'm going to say in light of that, like assertiveness from women. So I'm going to say like, yes, but we're not the ones making the rules often, like, and
Yeah.
we like, right. So like, and like in terms of you something that stands out for me is like you said that 40% of pregnancies are unwanted. Like, what do you think about this Texas abortion ban? Like now you're going to have like all these women, like, and there's no exception in cases of rape or incest. So I'm violated and traumatized and impregnated. What is that going to do to the infant? It's insane.
Well, like I say, we got a deep problem that goes back a long time. But let me clarify again how we can create some change here.
Let's do it. Tell us how to do it.
So, as I've said, much of this information has been ignored for decades. So, you out there can make a difference by communicating with others who may have children in the future or who may know others who could have children in the future. Contact family, friends, and use social media. Also, contact news sources and urge reports on the origins of our personal and social problems. For more information, you can see my blog at ronaldgoldmanphd.com. In addition, contact local, state, and federal representatives to urge more support for families, starting with extended paid maternal leave. One of the most satisfying feelings we can have is to make a real difference in the world. This gives our lives more meaning and also supports our spiritual nature. As we make a difference, let's consider these ideas. We need to pay more attention to the commonplace instead of the unusual. We are wise to trust our intuition and experience more and experts less. We pay a high price for silence and denial. Just as fear in speaking out is contagious, courage in speaking out is contagious. It is critical that we empower ourselves and take action, though we may be in a minority. Our reluctance to accept our power is connected to our reluctance to accept responsibility. Progress depends on our accepting responsibility. As a final thought, for people to change, it helps if they feel loved and respected by the people who offer them change. Learning new information, perspectives, and solutions depends on our feeling good about ourselves and the person informing us. When your message is love rather than confrontation, you recognize that changing others likely means changing yourself. This is a significant personal growth opportunity. So let's learn to lead with love.
Thank you for that, Dr. Goldman. That's a beautiful, beautiful closing to that conversation. And yes, exactly. Violence perpetuates violence. Love perpetuates love. And compassion is the root. So thank you so much for sharing your wisdom and your brilliance. And I'm going to suggest, I love your call to action. What I heard in that is you're like mobilized, organized, become activists and ask for more, demand more than this, poop sandwich that we're being handed in terms of how we birth and raise and commune together as humans. We deserve more, and to take back our power. And that's only going to come from us activating and organizing around it and no longer being complacent and just absorbing it. So I'm just going to say to our audience, if you've been touched, moved, and inspired by this episode, please share it. People need to know, we all need to know the impact of our early childhood experiences on who we are as adults and who we are as a society. And the only way to change it is to start at the root. So thank you, Dr. Goldman. How can people continue to get in touch with you? And we will absolutely add all these links, as I said, under the video. But if you could give your URL and your social media contacts and also your GoFundMe information as well.
Okay, thank you. I have a website, which is ronaldgoldmanphd.com. And I also have social media accounts at the usual Facebook, Twitter, YouTube, and LinkedIn. Icons and links to those accounts are at the bottom of my website page. So I certainly invite you to learn more about this and please share with others. We have the power and we can make a difference. So let's do it. Thanks very much to you, Devi, and to your viewers and listeners.
Yay. Thank you so much. Thank you, everyone, for tuning in and joining us this evening. I hope you have been touched, moved, and inspired as much as I have by this episode. As we said before, please share widely, spread the good word, and make sure you go check out rongoldmanphd.com to find out more information. You're also an author, correct? You wrote a book about circumcision trauma. Is that correct?
I did. And just to be sure there's no misunderstanding, the website is Ronald Goldman, PhD.
Ronald Goldman. Perfect. Okay. Ronald Goldman, PhD. Thank you for that correction. All right, go to Ronald Goldman, PhD at phd.com and check out the website and the book and all of the pertinent information. Have a beautiful night, everyone. Thank you for listening, and we'll see you next week.